Here at ChatHealth, we support clinical teams across the UK that want to set up safe and secure messaging services between their clinicians and their service users. When we're helping a new team set up a ChatHealth messaging service, an awful lot of the project management is handled from our end because we really want to limit the impact on capacity at your end. So our engineers will talk to your IT guys to make sure that we can get you set up securely.
So service users interact with ChatHealth using their normal mobile devices, whether that be a text message or using our mobile messaging app. And the nurses then respond to them using a web-based application system to ensure safe and secure messaging. We train you in how to use a web application for ChatHealth, but also part of my role is really important in kind of supporting clinicians and supporting healthcare professionals to use ChatHealth safely. So it's ways that we do that in terms of looking at guidance and reducing risk, but also in terms of setting templates up, talking about confidentiality, letting people be anonymous, and the way that we can support you to do that.
Lots of teams that adopt ChatHealth also adopt a sort of single point of access and triage model. This is really relevant if we get into business cases and business modelling. So in this model, one clinician, and actually it's usually less than a whole-time equivalent, will triage everything that comes in from quite a large population of people, and they can be dealing with up to 1,000 conversations across the course of a year. So if you start to look at the traditional ways that you might deliver that and the cost of delivering that kind of increased impact in a face-to-face way, you can see how the efficiencies of messaging really start to add up.
So if you decide to implement ChatHealth, you'll get regular contact throughout. We will ensure that you're supported and your staff feel supported. You'll get introductory sessions and you'll get support with engaging staff, because we understand that we're asking you to kind of use a web application, which is a piece of technology, but also it's a different way of working and a new way of working.
We also run a marketing work stream that helps you to start promoting the service. So the clinical support, the engineering, the marketing, or all the project management is all covered by a one-time only setup fee.
So the implementation process for ChatHealth will take about 3 months, and throughout that time we'll ensure that we're kind of supporting you and that we're ensuring that things are getting delivered when they should be, to ensure that we'll meet the training deadlines and the launch dates that you put. I will also support you with clinical elements, so we'll have a clinical call and there will be lots of clinical support about how we kind of make ChatHealth bespoke to your organisation. So although we kind of provide the product, it's very much about how you want it to fit with you and your working practices. We found that the practitioners using ChatHealth actually find it really gratifying. They're having contact with more service users about a broader range of issues, and it's really quick and easy for them to use. So if you use a triage model approach with your use of ChatHealth, you'll probably find that will release a lot of time to care for your wider workforce. The majority of the inquiries that come through to ChatHealth are dealt with by the triage team, and so actually that's releasing that time for those face-to-face contacts that are really needed and wanted. As healthcare professionals, we work with service users that are actually speaking less on the phone but are using their mobile devices to interact with family, friends, etc. in different ways, using text messaging, using applications, etc. And so we need to think of different ways and innovative ways that we can communicate with them too.
Once you're up and running with ChatHealth, we provide you with a fully managed service, so we're always at the other end of the phone to ensure that everything runs smoothly for you. Our techie guys will keep on developing the product to keep us one step ahead of the digital world. We'll make sure we always update you on the current safety protocols and working practices, and we'll be working continuously to keep your data secure so that you always meet up to information governance standards. All of that is covered by our annual licensing cost, which we base on your number of staff users. Finally, we'll set up your SMS account, which is dedicated to you, so all you've got to do then is add some credit to it and you're ready to go for it.